First, though, our next guest has one of the most important jobs in the country right now and has provided a much-needed voice of calm in Number 10 in those daily press briefings.
Deputy Chief Medical Officer Dr Jenny Harries joins us now from her office in London, where she is hard at work on the fight against coronavirus. Thank you very much for joining us. I know you're extremely busy right now. A lot of talk, obviously, has been about this antibody test. We were talking with Dr Zoe just now, and a lot is pinned on whether or not this actually works, how successful this will be. How hopeful are you of that?
So I think eventually it will be really helpful. It's going to be quite a game changer. I think the Chief Medical Officer has said that before. And that's for two reasons. Firstly, it will tell us which of us have had the disease. And that's very important, particularly for our health and care staff, so that they can be confident that they can be at work, have no risk of getting the disease themselves, and most importantly, obviously, not passing it on to other vulnerable people. But the other reason it will be really important is because it will allow us to look at how the disease has been transmitted and spread across a representative sample of the population. And from that, we'll be able to gauge what has happened, if you like, across the UK. And that will guide us in the tail end of the outbreak here.
And so, I mean, a lot of people's imaginations run away with them, and then there's a bit of fake news, and people are very, very impatient, quite obviously. But it appears to be taking too long. We watched the briefing yesterday, and you said it's much more dangerous to have a test out there that is inaccurate rather than wait a few more days to have one that is accurate. But then people are expecting within a week they're going to get it in boots.
Yeah, so I think our ambition is right, but the caution is also correct. So just as an example, if we have the antibody test and it's a kind of, for want of a better way of describing it, a kind of pregnancy test, a point of care test, for those people who are positive on that test, it's highly likely, at least in the early phase, that we would have to follow that up with a serology test. That's the kind of the routine checking test. That may, over time, it will give us a good estimate of disease. But for somebody, as I've said, like a healthcare worker, we need to be absolutely 100% confident that those individuals have had the disease before we're putting them forward with vulnerable people. So the ambition is right. The government has ordered, as you know, 3.5 million tests. And the evaluation of those tests is ongoing. But we do not want to put something which gives false reassurance or worst of all, if we have people who we are saying are test negative, it will actually defeat the whole purpose of our social distancing policy and how we actually manage and control the outbreak. So really, really important. But we are trying, it's in all of our interest to get that test out there as soon as possible.
And frontline NHS doctors, nurses, staff, absolutely first in line for that.
Yes, absolutely. I mean, the idea would be obviously that we would have hundreds of thousands of these tests. And I know for your viewers, individual people, you want to know whether you've had it or not. It sort of affects what you're doing. It might calm people, for example, if they have a very vulnerable adult in their house that they're concerned they might pass on the virus to. But we have to be really supportive of our frontline staff, and that's both in health and care sector, but also other responders, people like the police and the ambulance service, to make sure that they are right at the top of that line.
Well, the World Health Organization has said that testing is the key to stopping this virus spreading. And you look at other countries, South Korea, the only country outside of China to flatten the outbreaks curve, and it's been conducting 3 times more daily tests despite having a smaller population than us. Are we sort of woefully behind other countries on this?
No, I mean, in the UK, we've conducted, I think we're nearly up to 100,000 tests, which is a very significant number of tests. And you'll see that our case numbers in the UK, although we expect them to rise and to rise significantly, we've done very well in the containment phase. And we've had a very clear plan in the UK to go from containment into delay. And at the point where we move into the pandemic phase, we do not want to spend our time testing out in the community when we have priority patients that we need to manage clinically. When the WHO talks about testing, they are addressing the whole global health system. And obviously people will realise that in many countries we do not have the same sorts of public public health infrastructure that we have in the UK. And it's important that WHO pushes in those countries to ensure any testing is done. So I think we're looking at a slightly different audience here. The UK has done a lot of testing. We are absolutely all united in wanting to push forward and do more. And there are significant plans, as I say, both on the antigen testing, the Have I Got It test, and the antibody testing.